It's come.
Okay. So let's wait for a couple of minutes. Just call Anand and Mirna. Every time we have to call some people.
Ma'am, are you able to see my
Yeah,
screen?
fully. Very nicely. Very nicely. 1 minute. Please call Anand. Sandhya, start.
Yes, ma'am. Good evening, all. Last few weeks, we have been discussing on blueprint of question paper. So we all know that question paper is so much important. So why is it important? We are all teachers, and we teach students, and we at the end of the session or at the end of one term, we expect the students to answer to our questions. So there are many ways of assessing, and one assessing tool is by way of question papers. So we all know for formative as well as summative assessment, question paper is a valid tool. So when you look into a good question paper, there are certain qualities.
Sorry, 1 minute. Assessment also shows whether you have reached to the student. Students have understood your teaching.
Yes,
and should you modify your teaching, and whether they are able to grasp and read correctly. So it is giving them a direction. Okay, start.
Yes, ma'am. So it is valid. We are able to, there are certain qualities like it is, whether it is valid, it has to be reliable, should be relevant to the topic, it should be objective, it should cover large areas of syllabus, it should give equal weightage to all domains, it should be well framed, it should be clear and unambiguous. These qualities are already been discussed in earlier presentations. So now coming to a formulation of a question paper, first we have to decide on the design of the question paper. So certain parameters are there that will contribute to the design. We will discuss that. Second step is the preparation of a blueprint, which will be taken later. Once the blueprint is there, you formulate the question paper. Along with that, you are supposed to give an answer key also. So what happens is that in our universities, we ask some subject expert to prepare the question paper. Along with the question paper, the university will ask the question paper setter to give the answers also along with the question paper. They will collect it. So what happens in us is that there is before the exam, there is a scrutiny which is happening for the question paper. So one subject expert from within our college or within the university, one subject expert will be called for scrutinizing the question paper. So 3 sets of questions will be given to the scrutiny person. He will scrutinize that. He will look into the syllabus. He will look into the textbooks or whatever means. Scrutiny will be done, and finally 3 questions will be finally handed over to the university persons. So that is one happening thing. Then on the day of exam, what happens is that there is another nodal person. Then there is a GDC Kottayam is the nodal center for undergraduate examination in KUHAS, in the KUHAS. So what happens in nodal center is that on the day of exam, another subject expert is being called. So by 9 o'clock, the students are expected to enter the examination hall. By 9:20, the question paper will be given to the students, and by 9:30, they will start writing. So they have 10 minutes of reading the question paper, and if there is any problem which they expect or see in the question paper, it has to be communicated to the staff invigilator there, and they will communicate that to the nodal officer. So the nodal officer will call a subject expert, and the subject expert, similar to the scrutiny person, we will come with the syllabus, and if there is any problem there, he will change the question. That means the change is happening on the day of exam also. That is happening in our university. So the problem, if the question paper setter is giving the answers, finally, that may not be the question which is happening given to the students. So there is a problem happening there. So the university, Kerala University, what they have decided is that there is a practical convener. Once the theory is over, there is a practical exam happening. So there is a chairman for the practical exams. The chairman is instructed to formulate the answers and given to the, he has to again sit and write the answers, and they have to give it to the university. So that is being followed in our university. So that is happening here. Once the model, in the normal steps, the question paper setter only has to provide the answers. Then you have to prepare a marking scheme, refine the question paper, edit, and finally review, and then you give the question paper to the students. So these are the 7 steps which we need to follow for preparing a question paper. So the first part is deciding on the design. Who will decide? Basically, it is given by the university. University will have a set of rules. They will, based on the policy, they will provide you. In our university, we have decided that 16 questions should be there for the summative examination. 16 questions. So that is already decided. This, in fact, is based on the guidelines of the Higher Academic Council, and also curriculum, syllabus, competencies, everything will be taken into consideration while deciding on the 16 question items. 16 questions or 16 items. Now coming to blueprint. What is blueprint? In nutshell, it is just the framework for the paper. It is the framework of the paper. It should be based, or it is based on the course content. We have to give weightage given to all different topics, different weightages we have to give, and it will be a guideline for marking. So this is basically what is blueprint. Ideally, it has to be designed by the university and provided to the teacher for question paper setting, or it can be done by a group of experts within the department of each institute. So that also is accepted. Now, how do we make a blueprint?
Sandhya, you will complete in 20 minutes now?
Yes, ma'am.
Yeah.
We have to, the blueprint has to, first thing is that we have to decide on the number of items. In my case, it's already decided 16 numbers given by the university. And now the next step is to find out what is the weightage of different topics. There is a formula. That is, you have to get the I and you have to get the F. What is I? I is impact on health. And what is F? F is the frequency of the disease. This is what is given in the medical thing. We can convert the same into the dental scenario, importance of the topics. We can convert the same thing into the importance of topic and convert. And this has already been taken earlier. That is score of 1, 2, and 3 is given. So when we take this score, impact and frequency into our scenario, what we have taken is the example of a FPD topic for final year part 2 students. So all the relevant topics have been given into these 9 headings. So introduction part will contain the indication, contraindications, those topics. Second, diagnosis will come that type of abutments, red defects, all those things come in the second level.
Go back one slide. Okay. Anybody wants to say anything in this? Occlusal relationship, I wanted you to comment. That's very important.
It's very important, ma'am. but undergraduate level, it
They
is
go
very
and
important.
practice.
We
They
teach
go and
for
practice
postgraduate.
anything and everything. So at least it should be 2 and 2, 4, no? It should be often asked.
Yes, ma'am.
2 and 1 is very rare.
So only one question normally it is asked, ma'am.
Exam drives, assessment drives education, how they study. If you don't ask questions in occlusal relationship, occlusion, they will not study. Okay?
Yes, ma'am.
Yeah.
So the third is design like laminate, post-endodontic restoration, resin bond, and all those topics. Clinical crown preparation, again, we have a preclinical aspect for that. That is the fourth thing. Impressions, the fifth chapter, which consists of gingival retraction to provisional restorations, requirement, materials, techniques, occlusal relationship, concepts, splints, TMD, all these things, laboratory procedures like dyes, alloys, casting techniques, etc. Shade selection comes there, and finishing and cementation. So these are the topics which are being divided into the 9 headings. And based on discussion among the staff members, impact and frequencies have been decided. And the I into F scores, like we got from 2 to 9, that is the scores which we received for that. And coming to the weightage coefficient, this is nothing but I into F divided by the total of I into F. The total of I into F in this we can get as 50. So each I into F parameter, each parameter should be divided by 50, and we are getting this. So now coming from here, the same answers
I want to tell you one thing. I don't want you to go into too much of calculations, because it is a very simple intelligence and your discretion that certain topics, if you say that they are all important to us, I agree. But then if you can give the important topics a wide coverage by asking one question in LAQ, one in SAQ, maybe some in MCQ, some in practical, you have some sort of a guideline for yourself. That is more important, and not this type of too much of calculation. If the too much of calculation you do, your co-examiner also three sets of paper by 3 exam, he may not be doing it. So actually speaking, what I want you to do is more for your formative exam first, and then apply it for the summative. And good to calculate, but not necessary to be very, very precise. So 0.18 of the weightage, what do you mean by that?
Ma'am, this weightage coefficient has to be converted into the number of items and the marks. That is how we relate that to the final thing. Because we already the number of items is set. So you have only 16 items in my Puhas. So this weightage coefficient means you have to multiply that into 16, and you are getting 2 questions. So minimum 2 questions we can ask from that particular topic. That is what is the inference.
Yeah, but if you ask 2 questions from that particular topic, then you may end up not asking from other topics, because our the portion is so vast. So think about it, because I feel that, see, it's like evidence-based dentistry. You want to go by evidence, you want to go by experience, or you want to have a balance of both. Complete evidence came because of pharmacology, all these things and all. But clinically, you don't have that kind of, one stray case is just like a story, anecdote. So think about it. Yeah, I would think that one occlusion question should be asked in every paper. Maybe it is asked in fixed, maybe it is asked in removable or complete denture, but the paper should have, so that the students start paying attention. They don't know much about occlusion because we have not been asking. Same thing has happened to us also. We were not asked, so we said, chalega, occlusion chhod dega to bhi pass ho jayega. That attitude comes in the students.
Yes, ma'am.
What you are showing is perfect, but you need to be more oriented, which is practical. Yeah.
Yes, ma'am. Now, after, so based on the coefficient, this coefficient, we can find out the number of questions, items which we can formulate. And also the advantage is that you will get the marks also. Like for that particular chapter, how much marks also can, because we know the number of items. So again, that is possible. So based on this, this is the framework which we have made. That is, we have to assess the knowledge, we have to assess the understanding, we have to assess the application. In KUHAS, we have only 3 questions format, that is a structured essay, SCQ, short essay, then short note. These are the 3 things which are there. So the 3 things are being put in the knowledge group, the understanding group, and the applications. So all the 16 questions are being spread out in different levels. That is the knowledge level, the understanding level, and the applications level. And as initially said, you have the first introduction part. We can have 2 questions, that is 13 marks. So one is a structured essay of 10 marks and one short note of 3 marks can be given in that. So we can mix and match many things. We can put it in the knowledge zone or the understanding zone or the application zone. Based on our interest or assessment technique, we can formulate. So this is the framework, and based on this, we have set the model question paper, the structured essay from the 13 marks group. One is the enlist the principles of tooth preparation, describe the sequential steps in the preparation of 1-1 to receive a porcelain jacket crown. Second question is, Pontic is the key component in FPD. Explain the statement in detail. Briefly describe on the different types of Pontics.
Okay, Arun Kumar, please speak.
Ma'am, this is BDS question paper, and questions are mentioned as 16 and the mark 70. We generally have a single paper of CD, RPD, and FPD. So I think the mark distribution in case of BDS, it's a single subject as a prosthodontics.
So it differs from university to university. So you ignore that. But my question to you is, the introduction part of FPD encompasses what all topics, Sandhya?
Ma'am, it includes the indications, contraindication parts like retainers, Pontics, connectors, and classification. So the major portion is on the introduction part. So Pontics being important is coming in the introduction part.
But I think the abutment, the factors which are compromised abutment, etc., they are also equally important.
Yes, ma'am.
Yeah. And in fact, when you ask that, the principles of fixed partial denture come in that.
Yes, ma'am.
Is embedded in that. So, okay, because one particular chapter giving 13 marks is a choice by the examiner. You have your own freedom. But we need to ask the students about, I would take out some marks from there and put it in the occlusion. Yeah.
Okay, ma'am.
And sometimes students don't think about some topics because we are the culprits. We don't ask them. Okay, fine. Go ahead.
Now coming to the short essay questions. The 4 questions in short essay. What are the factors influencing abutment selection in, fixed partial restorations? Second is classify the post and core systems. Third is the mechanical methods of gingival retraction in impression making. And the fourth is ideal requirements of provisional restorations for 5 marks.
Anyone wants to say anything? I think the questions are very brilliantly framed. Even before and now also. Anybody wants to give any input? Okay, go ahead. They are all taken Mount Breath. Bolo.
Ma'am, no, ma'am. All questions are framed well, ma'am.
Yeah. Okay, go ahead.
And the last part is the short notes. We have 10 short notes, 3 marks each. Split Pontic. First one is a split Pontic non-rigid connector. Second is advantages and disadvantage of putty wash impression, limitations of direct technique of professional fabrication, procedure of shade selection with shade guide, management of pyre abutment, indications of subgingival finish lines, canine guided occlusion, biological failures in FPD, salient features of glass ionomer cement for luting, compare Maryland Bridge with Virginia Bridge.
But I would not agree with the question salient features of glass ionomer cement for luting and 10x3. Can you make the frame that question well? What do you mean by salient features? Its composition, its manipulation, everything is included, no?
Madam, the question can be framed as luting agents for fixed partial dentures.
No, she wants to ask for glass ionomer. That's perfectly fine. The newer glass ionomers are all very good. So that's okay. I'm not telling her to change the topic or the subject, but I was telling to make the students' work easy, examiners' work easy. Can we frame it and be specific? Can a student write canine guided occlusion for
manipulation of glass ionomer cement for luting? Can it be done like that?
No, not only manipulation, it is also, see, glass ionomer cement is not only mixing or the properties or the manipulation, it's also the, how you use it, how you prepare the patient and the crown, everything is included. And when you say canine guided occlusion, can a BDS student write so much?
Correct.
10 marks? If
No,
you're
ma'am, it's for 3 marks.
Three marks, ma'am.
okay.
3 marks.
Okay, 10 question 3, perfectly okay. Yeah, even salient feature is okay then. I'm
3 marks, ma'am.
fine. All questions are okay. Okay.
Ma'am, question 1 requires some refinement, ma'am. The short notes question 1.
Show me back. Split pontic non-rigid connector. What do you want to say?
Ma'am, what we want to ask in this?
Can
Because
you-
anything can be written on this, so the evaluator won't have.
Actually, I wanted them to, Dr. Arun, you can answer. No problem.
No, ma'am. If it can be specific, what we want to, what are the advantages of split pontic non-rigid connector, or where are the split pontic non-rigid connectors are indicated? So since it is a specific, the 3 marks question, the person can,
Yeah,
if he writes any.
indications for non-rigid
Even if they can draw, that is also acceptable.
Drawing is not everybody's cup of tea. That we have
Yes,
even
ma'am. Yes, ma'am.
earlier. So drawing should be diagrammatic, not drawing.
Yes,
Ma'am,
ma'am.
for 3 marks question, ma'am, there will be some model answers, ma'am.
Model answer in the form of points.
Yes, ma'am.
Yeah.
Like if they include those at least minimum 2 points, then the marks will be given, ma'am.
Yeah. So very nicely framed. She wants to know steps of shade selection with shade guide. So there are very types of shade guides. And when you use the, conventional shade guides, how do you check? In what light do you check? How to discussion with the, so they will also write in points. So this also needs to be trained to the students. Otherwise, this question is 10-mark question.
No, ma'am. Shade selection is 3 marks, ma'am.
I know.
No, but ideally it is, yes, ma'am. It is for 5
Yeah,
or 10
ideally
marks.
it is 10 marks for PG level.
Even the pyre abutment, no? Management of, see, the question should be specifically framed to remove the doubt from the student's mind what to write. And they should be trained in short essay questions in such a manner that in the 3 marks and 5 minutes or whatever minutes, they will be able to write so that they get 1 marks each. So for 3 points or 6 points, half mark, you have to give them marks. This should be clear with all the paper who are correctors. When you say advantage and disadvantage putty wash impression for undergraduate student, so, there are lots of things he can write in points and get the marks. So you have to be clear with the instruction to the correctors. Otherwise, you have to be very specific. I said indications for non-rigid connector. And also when you say limitations of direct technique for provisional fabrication, any 5 or whatever, and shade selection. Broadly, how would you make it more specific? When you say procedure, it's complete procedure. Do you want to ask the type of light, the type of, you want to ask regarding the patient's face?
Environment.
So you can be, for 3-mark question, we can be, unless you have trained the students that आपको environment भी बोलना है, patient shape, face shape or whatever, patient also has to agree. With a young lady or elderly lady, how will you select? And we all think of the one monochromatic teeth, what we have in India, but people have choice. Patients have choice. So, otherwise they are decently, nicely prepared questions. I must congratulate.
Thank you, ma'am.
Yeah, but please be more specific. Yeah.
Yes, ma'am. Yes.
Okay. Okay. Now Anand is ready. Anand.
Madam, sir is not there.
Okay. So, you stop sharing. Now, can you talk about your project? Sandhya, start with you. It will be the order of Sandhya, Meenakshi, Rohit, Mirna, Shilpa, Siddharth, and Arun. Okay, so everybody gets a fair chance. Otherwise, we start in the first with Arun and we don't go ahead at all. So let's go reverse direction. Did you get your...
Ma'am, are you able to hear me?
I am able to hear you. Are you presenting or you're talking?
No, I'm just searching for my presentation, ma'am. I'm not taken that. 2 minutes, I will.
Who is ready? Meenakshi, are you ready to talk at least?
Madam,
Yes, ma'am. Am I audible, ma'am?
Yeah, you are. Can somebody call Anand? He wrote to me that he is presenting.
Okay. Ma'am, my topic is on need assessment of nutritional analysis among third year and final year BDS students.
Come again and everybody listen to the topic. What you understand by that? Nutritional?
Ma'am, just a second, ma'am. I'm sure. Do I have to share the Word document or something, ma'am?
It will be nice. Yeah, you can do that.
Okay.
Please be ready with the presentations, all of you. Baitna nahi, chalo, jaldi karo.
Ma'am, is it visible, ma'am?
Yes, of course.
Yes, ma'am. So the title of my project is The Need Assessment of Knowledge and Understanding of Dental Students on Diet or Nutritional Counseling for Geriatric Denture Wearers. So this was the title. After having discussion with Ashwini ma'am and Suhasini ma'am and Chinmay sir, I could design my project, ma'am. So based on that, and these were my short-term outcomes, intermediate and long-term outcomes, where I will be administering the questionnaire, that is the pre-administered questionnaire, after having the content validity and the item analysis, which has been done by a nutritionist and 3 of my faculty members on the questionnaire which was developed. And we got a Cronbach's alpha item analysis of 0.7, which was quite good enough after evaluating among all the students who were taken for the pilot, and later it was administered, ma'am. So these are my short-term, intermediate, and long-term outcomes. And my main aim of my this project would be to enhance the knowledge on nutrition requirements for geriatric denture wearers per se, where nutrition and overall geriatric nutrition has been considered, but after rehabilitating patients with dentures, we are not giving a salient knowledge or a few knowledge about what kind of nutrition the student has to advise to the patients, and follow-up also is required equally. So on those grounds, I have structured my the current project. So these are my references, and so far there are no studies which has been done where students were assessed on nutritional knowledge after delivering dentures or follow-ups which has been done by the students, and hence this study was
So
taken.
please share your questions that
Yes,
what-
yes, yes, ma'am. So this was the item analysis done, and these are the nutritional questionnaire where I've taken your
Please,
inputs.
please
And
read it. Please read it.
yes, ma'am. Do you give the nutrition questionnaire includes around, ma'am, it includes the attitude component and the barriers component after having the knowledge component assessment.
Have you adapted the questionnaire from somewhere?
Yes, yes, ma'am. Yes, ma'am.
Just 1 minute, 1 minute. Alina. Yes, yes.
Yes, ma'am.
So did you take the permission from them?
Yes, yes, ma'am. I've taken the permission from them, ma'am. Yes, ma'am.
And your ethics committee has passed?
Yes, ma'am. Yes, ma'am. I've
And how
taken the
many
ethical clearance.
questionnaire have you given the students? How many
What?
students have you given the question?
Ma'am, totally around 108, ma'am. 50 third-year students and 80 final-year students.
Okay.
From 2 years, ma'am.
And they all answered.
Yes, yes, ma'am. Yes.
So are you taking the sessions for them?
Yes, ma'am.
Yeah.
I have done the pre-test, ma'am. Now I'm going to conduct a workshop, nutrition workshop for them along with my
How many workshops? Like,
ma'am, 1-day workshop, ma'am.
But I would suggest that you must take a workshop,
Yes,
give them some time to internalize, read and all. And
Okay,
then
ma'am.
next day you can have a quiz or you
Yes,
can
ma'am.
have, yeah. So that
Ma'am, the
you
same,
are
the
well
same.
versed and then they will answer it properly.
Done, ma'am. Done, ma'am.
Yeah.
Done.
Yeah.
Ma'am,
So
I thought
please
I'll
take the
administer the
question.
same questions as post-test survey, ma'am, and take pre-test where they've already answered now. After conducting the workshop, I'll be administering the same questions as post-test survey. So we will be able to assess their knowledge before and after. So these are the knowledge components, ma'am, whether they are, because micronutrients, macronutrients information also they should know from final years and interns, because these are the areas where they usually lag. And final year students, since they are into the process department, they're fabricating processes, follow-ups are also not done. So maybe if these questions are asked to them, they will get to know the importance of why we are conducting this workshop also. So what is the importance of micronutrients, macronutrients? If they're having systemic diseases, should they be referred to a nutritionist? Are that component?
Outcome of this should be,
Yes, ma'am.
that one session should be included in third year and final year.
Yes, ma'am.
Or second year and third year.
Yes, ma'am.
Regarding the nutrition importance and how do you counsel the patient, not in a very like a nutritionist, but
Yes,
at
ma'am.
least at your level.
Yes, ma'am.
And it should be there as a written instruction given in their language,
Yes, ma'am.
or at least sent on the mobile. You create something by
Yes,
which
ma'am.
there is a utility factor for this.
Yes, ma'am. Ma'am, we are planning to do a healthy meal plate and a pamphlet so that it is easy for them after wearing the dentures on the first post insertion, second post insertion.
But the pamphlet will not be sustainable.
Okay, ma'am.
Because it costs money. You may do for the first 100 patients because you are enthusiastic, you want to publish.
Okay, ma'am.
Later on, it will dwindle. Do the pamphlet, but
Okay.
slowly make it digital.
Okay,
And
ma'am.
also put it up in the department in 3-4 ways as a poster.
Okay, ma'am.
And ask the students.
Okay.
You know,
Their feedback, ma'am.
yeah, so not only that, if the students can give them their own way, some people can't read, some people can read. You know Kannada, I don't know Kannada.
Yes, ma'am.
So something has to come out
Okay, ma'am.
by that.
Ma'am, yes, ma'am. Thank you so much, ma'am. Even pictorial representation in the form of pyramid, we thought of having a food pyramid and asking them to know for the first day after getting the dentures how you're supposed to eat, second day, third day, and the sequence way. Because this prosthodontis day, this Jan, we did a nutritional
Pyramid is very scientific. The patients, educated patients only will understand.
Okay,
Generally, you give a chart wherein you have that niche wo jo broad bottom hai na.
Yes, ma'am.
You can give greens and fruits and other things. Then your pulses and other things. So, and then whatever carbohydrates you have. And
Yes,
in
ma'am.
Karnataka, millets are quite a few.
Yes, ma'am.
Yeah. But see, the when you are talking about nutrition, so I am telling you,
Yes, ma'am.
the nachini has a very high glycemic index. Do you know that? What is nachini millet? In Marathi, we call it nachini.
Oh, that.
Ragi, ma'am.
Ragi.
Okay.
Ragi.
Okay, ma'am.
I was about to Google that.
Okay.
So ragi is very good, but high in is a
Glycemic
high
index.
glycemic index. Immediately the blood sugar shoots up.
Okay, ma'am.
So when the students will tell them to eat, but lot of ragi is eaten in Karnataka. What I saw is.
Yes, ma'am. Even in Mysore district also, ragi consumption is a little more.
Yeah, but you have to think about it. Ragi
Yes,
is
yes,
very
ma'am.
good actually.
Mm.
I don't know, but you
Ma'am,
just you see that. See
yes,
the
ma'am.
students when they are doing nutritional counseling,
Yes,
they
ma'am.
have to know a lot of things. Otherwise, you leave it to a nutritionist.
Yes, ma'am.
Yeah. Because
Yes.
now people, everything is changing in
Right,
nutrition.
ma'am. So
Fat
these are
is
some
being
of the,
given a lot of importance.
yes, ma'am. So these are some of the recommendations which they should know in relation to older patients, which most of them will not be knowing. So we'll sensitize them in the workshop, and then this will be administered to them as post-test questionnaire. So this is the knowledge of the diet recommendation on the first post-insertion day, what and all they should, in the different food groups. As per the ICMR guidelines, there is vegetable fruit group, bread cereal group, milk group, and meat and protein group. So first insertion day, what they'll do. Second,
This should also include easy for a laborer also.
yes,
He's
ma'am.
not going to make a juice.
Yes, ma'am. So these are the attitude component where they're giving us the details regarding why this is more important and what is that which is hindering them giving the nutritional guidelines for patients. So these are the 8 questions on attitude component. I've also included barriers. What could be the common barriers which they have encountered, which has avoided them from giving the nutritional counseling. So these are the 4 barriers which I felt, and even I've consulted our HOD and the rest of the members.
First is lack of knowledge and giving importance by us.
Yes, ma'am.
In the academic inclusion in the syllabus.
Okay, ma'am.
There is no time constraint as such at all, according to me.
Yes, ma'am. But still, most of them don't do it, ma'am. Even after
patient compliance reimbursement is a constraint for diet counseling.
Ma'am, that's because if at all, if we direct it to the nutritionist, probably maybe he or she would be willing. So this we will be explaining to them, and then we will be asking them the answers for it.
See, don't include the nutritionist here. You are making the second and third year students counsel. That is not costing the money.
Okay, ma'am.
That is no time restraint. There is a lack of knowledge and the attitude is not there because we have not given them the knowledge.
Okay, ma'am.
The imparting is not there included in the syllabus.
Yes, ma'am.
Okay, great. Next.
Thank you, ma'am.
So please keep on updating me from henceforward every week.
Sure, ma'am.
Separately on a WhatsApp to me.
Yes, ma'am.
Because now if you're not doing the project, we cannot be certifying you, right? That's why.
Yes, ma'am.
Okay, Sandhya, nahi ho gaya. Not ready still? No speak.
Yes, ma'am. Ready. Are you able to see, ma'am?
No. Not yet.
Title is, yes, ma'am?
Yes, ma'am.
Now I can see.
Are you able to see?
Yes.
Yeah. The title is Evaluating the Quality of Postgraduate Education in Government Dental College, Kottayam using Modified Theme Questionnaire. Learning environment is an educational climate and academic culture pertaining to that institute. It's a complex and multifaceted field.
Sandhya, I must congratulate your HOD and Dean to allowing you to do this project. Huh? They're broad-minded people.
Yes,
many people are very narrow-minded. They will not allow.
I don't know, like I submitted in the scientific committee, they didn't say anything.
Yeah.
And last week only I got the ethical
No, see,
clearance certificate.
that means to say they are open to your suggestion. I'm very happy with it.
Yes,
Ma'am,
ma'am.
sometimes it's very difficult to get permission because I
Yes,
struggle
yes.
3 months.
I thought when
Yeah.
she told me, I thought she will not get ethics committee permission. Because the people who are sitting, they mean they have a position. They feel, "Arey, something comes out and she will publish and all." Don't
Yes, ma'am.
publish if immediately, Sandhya, because we
Yes,
owe
ma'am.
it to our institution.
Yes,
You can
ma'am.
improvise it and then you can compare and publish it. I'll tell you what to do. Yeah.
Yeah.
Okay, go ahead.
So clinical environment, it is important for the postgraduate education because it provides learning environment as well as patient care, and there should be a balance. The objectives of my study is primary to evaluate the quality of postgraduate education in GDC Kottayam. Secondary objective is to compare the quality of postgraduate education between departments. Based on the next is the based on the year of residency, and to describe the potential for improvement in the quality of postgraduate education due with the qualitative aspect of the research. Materials and methods, study setting, PG departments, GDC Kottayam, study design, mixed method, a descriptive study, study participants, postgraduate of 21-22, 22-23, and 23-24. Sample size, entire sampling frame, sampling, entire sampling. Questionnaire is the theme questionnaire, which is already available in the freely available. First part of the questionnaire will be consist of year of residency, age, gender, department, institute of undergraduate, and number of attempts in postgraduate education, which I will be adding. It is not there in the questionnaire, which I will be adding to get additional information. Modified questionnaire will be the second part, and the items will be adapted from the theme questionnaire, and content and face validations will be done for that. Final score of the questionnaire. This questionnaire consists of 40 items in 3 domains, that is perceptions of role of autonomy, role of teaching, and social support. So these are the 3 main domains in the questionnaire, and the items will be checked, taken from, the questions will be from these domains, and findings will be taken. Participants have to, their opinion is taken in the 4-point Likert scale, ranging from strongly agree to strongly disagree. Third part of the questionnaire is the qualitative aspect. Questions like, what more do you think should be included in the postgraduate education which you have now? Please elaborate. And what do you think should be removed from the existing postgraduate education? Please elaborate. These are the 2 questions which I thought the students might include. I don't know how many is going to respond to this, but still I'm giving them an option to answer. Answers will be analyzed through thematic analysis. Informed consent will be obtained from the study participants.
You describe the population?
Ma'am, all the postgraduates of our college, all the departments, 9 departments.
Existing
3
or
years.
past? Existing?
Yes.
Why can't it be with the past?
Ma'am, past, prosto I can get, madam, but others, it is difficult.
Because, that will give you, these students may not be answering very freely. The past students, when we have done studies previously last year also, the past students about maxillofacial prosthodontics to create a curriculum we did, the past students answered very well. So you do for prostho at least, and for our own knowledge,
Yes,
and
ma'am.
also try with other departments if they can help you. Like how you
Yes,
have
ma'am.
prosto people, like that they will have the conservative people who are practicing outside.
Yes, ma'am. They have, but access is slightly difficult, madam. That is why I restricted to, because
Okay.
this permission also, because students are there, I can easily get the permission. Means past means, again, I'll have to
Okay.
ask the permission.
Yeah, you have to go back to ethics and they will change their mind.
Yes.
Okay. But see, it will be a little biased study. As a student, I will not be frank.
True, ma'am, but I agree with that. But let's try, ma'am. I mean, I don't know what
Have
is
they to
going to
write
be
their
the result,
name?
but
Have they to
let's
write
see.
their-
If it
have
is
they-
not positive, also I'm expecting not positive answers, but still,
1 minute. Have they to write their name?
they can write or they cannot. I
You
mean,
should
and that's
have
their
told,
wish.
do not reveal your identity.
Okay, ma'am.
Then at the end, in that case, I don't know what to do about the department. Okay. Okay, let it be. Don't
So
change it.
this is the statistical analysis.
Don't change
Quality.
anything. Don't change.
Yes, ma'am.
Sandhya, is there a problem to hear me?
Yes, ma'am. Your for me, your audio is coming late, ma'am.
Okay, then.
I don't know. Maybe my internet problem. I don't know.
Yeah, but whenever you hear, you wait.
Yes, ma'am.
What you're doing is you're not waiting at all. Now, since you have taken the ethics permission, now don't give any instructions to not to write your name. It's optional, you have said. So go ahead with that. See, I'm writing Suhasini Nagda, Prosto Department, and answering certain question. I will write average Narova Kunjarova because I am scared of my teacher. I have not yet passed.
Yes, ma'am.
The whole study should have been done with past postgraduate who are practicing or something. We'll continue that later. Now it's okay.
Yes, ma'am. Anticipated biases in the study is social desirability bias and response bias. So these are the statistics analysis span for Pheem square, unpaired t-test for the other. All this proportion for qualitative data, mean standard will be for quantitative data. For secondary objectives, dependent variables, like again the ANOVA part will be taken in all the 3 domains. Thematic analysis, this I'm not very sure, ma'am. I don't know whether I'll be getting it, but still that part I have kept.
Please
open.
keep it.
Yeah,
Please,
these
please.
are my references. Thank
Okay,
you.
show the theme question here to everybody.
Yes, ma'am.
And you're modified.
Yes, ma'am, I'm not modified it. I have to modify.
So next week you have to modify.
So questionnaire I'll show, ma'am.
Next week, next Tuesday, you are going to show me modified question.
Yes, ma'am.
Okay then, next one.
No, the questionnaire, ma'am, I'm sharing. So this is the 40 questions, ma'am.
I understand. We have seen this. It's freely available. You read important things. My teachers are accessible. My workload, the job is fine. Seniors.
Ma'am, I didn't hear you, ma'am. What did you tell?
I said, read at least some important questions.
Yes. My clinical teacher set clear expectations. One question. I have the appropriate level of responsibility in this post. The post which is meant as the residency program. There is racism in this post. My clinical teachers have good communication skills.
These
There are
questions,
clear.
racism and all should be removed.
Ma'am, there could be, ma'am.
Achha, okay.
Racism in our scenario, we do have students coming from other sections. So there could be.
But from Kerala only, na?
No, ma'am, we have all India also.
Okay, yeah.
We have all India quota.
Yeah. So
we have from Northeast also. I have a student from Northeast.
Yeah, yeah, but
and that too, we have that caste. Everything is there, ma'am.
I understand, but I know of people from Trivandrum. They are shining today. Then from North, Dr. Mahesh Verma.
Yes, ma'am.
So he said he has the best time.
Yes, ma'am.
And
I totally agree, ma'am.
Yeah. So what changes us? That is the individual narrow-mindedness. Do you think nowadays your children will bother about marrying
No.
only Keralite and South Indian? They are all
No,
Indian.
ma'am. No, ma'am.
Ours
In
is
my
a-
generation also, we don't normally think like that,
I
ma'am.
am a South
So the next
Indian.
generation, 100% they will not think.
I am a South Indian, IR Tamilian. My husband is from Kutch, Gujarat. Okay.
Yes,
And
ma'am.
my children, one son has married a Shetty, and another one has married Gujarati from Mumbai. I have 4 sons, I have told you, the twins. So one in San Francisco has a girlfriend from Himachal Pradesh. And his brother has a girlfriend. They're getting married next year. They're from Mumbai, but they are basically doctors, one from Goa and one from Mumbai. So no one is going to listen to us. The future generation will show the old people what is caste and creed and language. It doesn't matter. I have people who are married Irish person, and that family is better than Indian family. They're so close. So I think that racism part, I don't know. I don't know. I cannot be racist. For me, what matters is in my front, you're sitting, you're talking well, you're responding, you're kind to me and I'm kind to you. That's all matters. You
Yes,
think
ma'am.
India is full of racism? It's sad, man. It is sad.
Yes, ma'am. Anyway, I will discuss, ma'am, with the subject experts here
So
because I have.
do you differentiate between people like us who come out of Kerala?
No, ma'am, it is not like that. But there are teachers, colleagues of. It's not,
So
ma'am. In
there
this,
should be a faculty development program for.
Yes, ma'am.
Yeah.
Ma'am, it is not that. It is only prosto.
Ma'am, I worked in Kasargod, ma'am, for 2.5 years. I must say, ma'am, they don't actually speak to the non-Malayalis.
अच्छा
They don't entertain much, ma'am. Yes, ma'am.
अरे बॉम्बे आ जाओ हम लोग सबको first day we become friendly in Nair
Yes,
hospital. You know, the students will go out of the way. Madam, they are out of, so the parents are not there. What should we do? They will ask. And usko jagah, they will give them place to stay and all. So the cultural difference is there here because we see all types of people. I don't know if this is still existing it is existing in India. I know about it. That is why BJP lost in UP, no? In spite of so much doing there, because there must be caste politics. First and foremost, the Hindu-Muslim should be removed. You pray the way you want, I pray the way I want. What difference does it make?
Correct, ma'am.
I don't know. It's sad. It should be like Australia and New Zealand. Whatever you want to do it inside your home. Nothing allowed. No procession, no Ganpati, no bang, and no shouting, and no nothing. You want to pray, you pray at home. But Sandhya, can those
Yes, ma'am.
students, after you do this course, can those teachers in general, not targeting them, can we talk about importance of just human relation? Only you have to talk.
I'll try, ma'am.
Yeah.
Ma'am, if I'm not wrong,
I'll try.
there is a NAC guideline which says about cultural diversity in education and recruitment of the
Yeah,
staff. as
that
well
is
as
true. That is true. We talk of diversity because if at all our students go to UK and US, there are in UK 200 ethnic groups found. But I'm not saying there is no casteism there because the first thing is color. You know, brown skin and white skin. That makes a lot of difference. They may not have racism, they have colorism. And it depends upon how we behave, how we teach our students to behave. if you show that you are very confident, they completely change their mind. But no one tells you anymore that India is a land of snakes and elephants. That they don't say. I have heard that in the early 80s and 90s, that time I don't know because I didn't go. I mean, we were just studying that time. So people have told that they feel everywhere on the road, cow is walking and elephants are walking and we snake puja and all those things. People may be doing snake worship, but that's only in certain parts where they believe, isn't it? And everybody is not doing everything. They also have so much of, we have to first and foremost understand that every human being has the same power and the same, ability. It's not that the lecture comes from a white skin, it becomes better. Our people also do, and it's up to us, how do we do? And these narrow-minded people will remove, I am worried only about, उसके नीचे जो स्टूडेंट आएगा ना वो भी नैरो माइंडेड हो जाएगा, उसको मस्का लगाते लगाते पास होएगा, but he will think I will do the same thing to my students now or my people around me. Cultural diversity, we talk of one side and we talk of this racism. Anyway, you include it since you have opened my eyes for that. See, basically, I don't care about caste or religion. It doesn't make me feel very happy or very oneness if I see a Tamilian. Because, of course, I have not lived in Tamil Nadu at all. I am a complete Bombayite. So I feel good for Gujarati also, for Tamil also, and for Himachal also. Same thing. And people who work with us, they are so important, So can we say those days, thousands of years back, when they made people as per their work or job was different. Don't we have to change now? It's just a dignity of labor. I think something your students should know. Apart from your lecture, 2-3 minutes of talk regarding a topic. Now this NEET exam, it dissuades so many people that they are giving the marks. They are not explained why they are giving the grace marks. If they explain, at least students would have accepted. You know about the NEET disaster. So
Yes,
I think it will dissuade children from coming forth and appearing for such exams. People who can afford, they just go away abroad. And now because of so much of government politics, people don't stay in India, they go abroad. Are we not losing people? Like the brain drain.
yes, ma'am.
And the opportunity is given abroad. We can create here. It's not that all dental college requires one big shake, vibrator. And that how it has to be completely be different than the present scenario. Anyway, go ahead.
Ma'am, this questionnaire I need to modify. Then
Okay, you
then
show it next Tuesday. Now who is
Yes, sir.
presenting? Who is presenting? No one is ready?
Nita ma'am,
Ma'am,
am I ready, ma'am?
can I say something, ma'am?
Yes.
Ma'am, I'll be presenting next Tuesday because I have already applied for the ethical committee clearance and it is going to be held in July in our college.
Whether you get the ethical committee or not, you present before me the outline next time.
Next time, ma'am, yeah. And I have talked to Dean personally, ma'am. She has told me to go ahead with the project and
Yeah, one more thing I want to tell you is next Tuesday we are going to take for you technology using assessment and portfolio as assessment. And we'll show you how you can create your portfolio. Oh, so please, can you join 15 minutes early so that this presentation will be over in half an hour? Can you join next time early, all of you?
Yes, ma'am.
Yes,
Yeah.
ma'am.
Join at 5:30, huh? So we can start by 5:35, 5:40. Okay. So who is presenting?
Ma'am, yes, ma'am.
Zara jaldi karo. Who will be ready after her?
Madam, it's me. It's me, madam.
Kaun?
Ma'am, Siddharth.
Okay. After that,
Arun sir, madam.
Arun sir. Okay. So Rohit will be doing next step.
Okay, ma'am.
You
Time
can
will
see
be
my
there, I'll
screen.
do today, another next time.
Yes.
Yes.
Okay. The topic is, ma'am, photo voice as a participatory action or research methodology. So this is a qualitative and quantitative based research. So
Can I just come in?
Yes, ma'am.
All of you, please see the diversity of educational points, research that you are learning with different projects, and see the mindset of everybody. I think Shilpa is always wanting to be ahead with technology, because whatever I discussed with her was always on more on going, in the futuristic approach. Very good. Come on.
Yes, ma'am. So in this picture, what we see is the person who is wearing a shoes of two different varieties. So this person has won the Olympic. So this picture exactly explain the person who with the type of quality of the photo wise. The second picture which explains that there is a series of garbage which is thrown out of the trash can. So in this exactly what we are trying to explain is, even though the people are very well educated, even though it is an urban city, it is not in a village where people don't know how to use the trash cans and all. So this kind of awareness which is needed for even including the well educated people. So this is exactly going to explain why this photo voice is very important for us to make sure that the people are aware of those how to use those things, even though everyone knows it, but still people are ignorant to follow the rules and regulations which is existing in our surrounding. So this picture again explains that there is one handicap person who cannot climb into the areas. So this is actually one of the issue which is existing right now in our college, ma'am. So in this, ma'am, this already I have explained, ma'am. So I will just go to the what exactly I have collected. I have conducted the meeting, ma'am. For first briefing was done with the students, and the students have given me the some pictures. This, ma'am. This is one of the pictures by first to final year, including interns. So there are 10 students, 2 students from each year I have selected. So I have explained them how to take the pictures and not to include a lot of naming of the department or the people's face and all, so that it will not be a problem for consent. When I have to publish it. So this exactly one of the issue which is existing in our department. And this is the second one, ma'am. And then the third one. And then fourth one. Fifth one. So these all, and one more thing, ma'am, this is one of the dental chair which there was a lot of tangled wires along with that. This was taken picture before there was a fire in the chair caught fire in, there was a fire in that chair, ma'am. So after the, when we have taken control of all the fire, this is the after picture. So in this, what exactly he was trying to explain is if the cords and all these extensions have been taken care, that fire wouldn't have happened in the our department. And this is actual problem which exists in our department in the college, because we have a oral surgery department which is in the ground floor. So they have made ramp only to reach that department, but the people who need a treatment to the especially conservative department, they were unable to go
No lift,
to that
no
particular
lift,
department.
lift. Lift.
Yes, ma'am. There is no lift, ma'am. There is no lift. There is no elevator. There is no ramp in our college, ma'am.
How many stories?
Ma'am, 100 students are there, ma'am, per batch.
No, how many levels?
Three levels, ma'am.
Then, madam,
So is in which?
We are in ground floor, ma'am.
So the best
And this
part
was
is
the actual
to
patient.
have a conservative person come down and do his work.
Yes, ma'am. That is what we are doing, ma'am, right now. That whatever the treatment the patient is needed, those particular PG students or the faculty will come down to the department which is there in the oral medicine or in our department, and they'll get the treatment. But this is
So
one
this
of
is the
the
opportunity for you to create a geriatric
yes,
department.
ma'am. Yes, ma'am. Yes, ma'am. And one more picture where my student, second year student, she fell and she had a fracture, and for 2 months she was unable to climb in any of the, because she was restricted. So for 2 months she has not attended any classes or any postings. So that has been one of the obstacle for her curriculum. So and that she did not send that picture, ma'am. That is one more thing which I have to include, ma'am. So till now, I have collected the pictures, and in the second meeting, I'll be.
Did you
Yes,
collect
ma'am.
20 pictures and select about few pictures? What did you do?
Ma'am, after collecting the pictures, I will have to categorize them. So after categorizing them, I will have to categorize, and then there will be a display of the photos, ma'am. Like.
So you will be giving the questions to the people who are participants. Describe
First,
the picture. What?
Yes, ma'am. Yes, ma'am. First, I have explained them what exactly makes them to take those pictures, why it is important for them, how it is affecting their life, is there any obstacle, is there any hindrance. So all those factors were given consideration, and then they made this. They have taken the pictures.
Your whole study will be only qualitative, right?
Yes, ma'am. Qualitative plus quantitative by giving
Yeah.
the question.
Yeah,
Yes,
that's
ma'am.
true. That's
Yes,
true.
ma'am.
Yeah.
Yes,
And secondly, now think of how you will use it in your institution and what level you will come to publish it.
Yes, ma'am.
Okay.
After the yes, ma'am, I have got the committee permission, ma'am. Yes, ma'am. So
You
after
are
the
in Madurai, na?
no, ma'am, I'm in Gulbarga. Earlier I was in Madurai, ma'am.
Yeah.
Now I shifted to Gulbarga.
So that implantologist was there. He still comes.
Which implant in Gulbarga, ma'am?
Yeah.
No, ma'am.
Rajendra Mohorkar, I think ma'am talking now.
No.
Ramesh Chaudhary, sir.
Yes,
ma'am. He comes, ma'am.
He comes when?
He last 2 months back he had a talk, ma'am, in our college. 2 months back.
So he's not a faculty anymore.
No, ma'am, he is not a faculty. He's in Oxford, ma'am.
No, madam, he is faculty,
Not in
right?
Oxford.
No, madam, he is faculty in Siddhartha Tumkur College. He is leading the implant department there. His wife is the vice principal of the college.
Where?
Nagalakshmi, madam, Tumkur, madam. Siddhartha.
Your college?
No, madam. It is the college name is Siddhartha Dental College.
So you must be owning it.
No. He is my UG staff, madam. I worked in his clinic in internship. So I know. Madam is the vice principal there. Sir is leading the. He was there in Rajarajeshwari and he moved to Tumkur.
Okay.
Okay, then once the one-on-one interview is over, ma'am, then we will have a. I have made them to make a short story about it. So they will have to write like 150 or 200 words. They will write a short story. Below that there will be a picture, and then I will have an exhibition like this, or like a photo exhibition. So once this is
What
done,
is-
I have
what-
given.
what is this? It's a social change to bring about.
It is a social. Yes, ma'am. It is
Can
a
you
social
say it
change.
is, no. Is it a psychodomain, psychospace, or is it because it is making people change also? And
Yes, ma'am.
ethical endurance, or it is being responsible for things? Think about it. All these questions, what I asked you, think about it.
Yes, ma'am. Yes, ma'am. So
See,
once
narrative. If a picture speaks 1,000 words, that's the thing you need to write. That picture speaks 1,000 words.
yes, ma'am.
Now, so it is important what we show the students also. And now when you see all this and have an exhibition, it's a very unique and very nice thing in our country. People have done that earlier. But
Yes.
this should bring about a change in the students. So you should have a theme. You
Yes,
should have
ma'am.
a theme. Supposing it is ethics, then all those things, not wearing gloves, coming close to the patient, or maybe, somebody who is not in a proper position, shouting at the patient. Maybe shouting is not shown here, but from your eyes and expression it is shown,
Yes.
or whatever. Anand Patil is still driving. That's what the message came on the laptop. See, what I'm telling you is we are almost towards the end of our sessions. Few important sessions are there. But if you don't attend personally now, you will not be able to use and apply it. My whole thing is that you should be able to apply it, and we must meet next year for your own what betterment, what have you progressed. It's called learning circle. I'll come to that later. So it's a lifelong journey of learning, relearning, removing the old learning, which is not SLD learning, all these things. So I think we have given a promise to ourselves, will they make best out of the session. So you must personally attend. That's what I feel. So you need to think. Now you're
Yes, ma'am.
taking general photographs, you will categorize it,
Yes,
but you
ma'am.
need to make a curriculum saying that this way ethics can be taught better.
Okay.
So this can be included in this professionalism, or maybe you are teaching them bioethics.
Okay.
So a picture speaks, and especially in our country with the garbage being thrown anywhere and everywhere by the patients.
Yes, ma'am.
So lot of things can help. It's a very strong voice. It's just not a photo voice, a strong voice.
Yes, ma'am.
How you will use it, I want to know, as I told Meenakshi, as to how you are going to create that sustainable change, and not a knee jerk that today you will do some photo, after 2 years everybody will forget. Somebody gives a nutritional counseling now, and after 2 years nobody gives. Aisa nahi chalega. Okay, Arun. The salad also.
Arun sir, are you presenting or I will present, sir?
If you're ready, you can present. Otherwise, I can.
I just show the progress of my project to madam once. Not take much time. Is it visible to everyone?
Yeah.
Arun sir is doing. Sir, you can do it, then I'll do after you. You can do it, sir.
I think
Good evening, ma'am.
it's from a mobile. That's why it's coming vertical images.
No, ma'am, I can convert.
Okay.
Ma'am, these are all my earlier sanctioned flights. I just will brush through all these things which have been
You need to
conferred
tell
by.
me in short everything.
All right, ma'am.
It's a recapture for you also and me also.
Okay, ma'am. Ma'am, my topic of my education project is need analysis to shorten preclinical exercise duration in the first year MDS. I'm the principal investigator.
1 minute. Can you use any other word for shorten?
Need us to reduce preclinical exercise.
Need analysis to determine preclinical exercise duration.
All right,
Because
ma'am.
then you are keeping it open, neither short, neither long.
Got it.
Okay.
Ma'am, here I'm introducing like why my topic is of relevance as of now. So I'll be telling that preclinical exercises have been done during the BDS category, but the same thing is
You
being.
must have a proof that you have collected that many of the colleges have 12 months, 6 months, or even longer or shorter. Okay.
Yes, ma'am. Yes, ma'am. My questionnaire also include all things, ma'am, so that I can come into the picture that what is the present scenario in the colleges.
The theory of change, why you started and want a change, you are envisioned the change because the duration is so much. The duration is
Yes.
6 months, duration is 12 months. See, let's not here be biased and say reduce or duration long or something. Let's say present duration.
Madam, the current DCI inspection performer, what we saw, madam, they have clearly mentioned it as the bench work is for 6 months, madam.
Okay, they have given 6 months. You can make them do 6 months part-time. You can, within that, starting after 3 months or 2 months, they can be working in the clinic plus do the bench
Exactly,
work.
madam. Exactly, madam.
Tera andar ka, what you do with your flexibility is there.
Yes, ma'am.
We are
Yes,
not following everything of DCI.
Yeah.
We are following as per our convenience rather. If you follow everything, it's very good. Because they have got lots of things written, which we never read.
They have this time, madam, they have given all the list of preclinicals as well to do. As compared to our time, madam, we didn't have
So
that
when
list.
was this? When was this out?
Madam, I guess, if I'm not wrong, madam, 8 months back.
Like the CBD curriculum.
Yeah, madam. It is totally given in the performer that
Is it a now by the government GR?
Madam, it's available on the DCA website when you go to the inspection.
No, but is it completely passed?
That is what they are asking us. The inspectors are asking us, madam, for each individual student. Like this preclinical is done or pending, done or pending.
You send me that for process.
Yeah, ma'am. Yeah.
I had that, but I was told this is not officially passed.
Last time they asked our students, madam.
So people have started following it up. It's good.
Yeah.
Okay.
Ma'am, the problem or the need why I'm doing this study is to, is there any necessity to determine, I'll also mention here, ma'am, determine what is the available clinical time during the MDS curriculum.
See, due to prolonged involvement in MDS preclinical exercise, reduces the available clinical time. These are all your opinion you are giving. In a problem or need, you must say all this, but state it in a very diplomatic way.
Okay.
You can say the current MDS preclinical work duration is 6 months to 12 months, and as per new DCI, this thing, it is 6 months.
Okay.
It is, we want to determine whether this duration reduces compromises clinical time duration, including their dissertation work.
All right.
And how to optimize, that is your whole thing, Arun. You are giving a guideline how to optimize the preclinical work for the students, how to optimize the quality and quantity of work.
Understood now.
Yeah. So make it 1, 2, 3.
Got it now. various students have basically preclinical as well as clinical exposure during their graduation. So there is a requirement of refresher course or an exposure to the preclinical exercises for a limited period is what is the context of study.
As we discussed, please modify this also.
All right.
Okay.
So the outcomes which I am aiming to get is the short-term outcomes are students' early transition to clinical phase, increase in students' motivation and satisfaction since they are treating patients early. Students can start the clinical cases early and also can do their the other assignments which are scheduled with our first year, second year, final. The intermediate outcomes would be.
You can use the word student engagement.
All right.
Student engagement with the patients leading to motivation and satisfaction. The third also and second also almost similar they are. So please, what we discussed, you put it.
Okay. So the other outcomes, the intermediate outcomes is their familiarity and responsibility as a clinician since they involve in clinical work, and they develop a professional identity as they are working
No.
on.
Intermediate outcome will not be familiarity, responsibility. The short term is early transition is your short term.
Okay.
So allow students, see, intermediate outcome is envisioned by you. Coin it properly, the words. It's just not familiarity. Their role as a clinician. You are determining that it helps to determine the role of the clinician, roles and responsibility of a clinician. You want to say that early, it helps them to determine their responsibility earlier.
They get the responsibility as a clinician.
No, this is not coined properly. Familiarity is not the word.
Ma'am, I'll skip that word. Allow students the role and responsibility of clinician.
Can you say help students, helps, assists?
Help students the roles and responsibility. Help students to their role as a clinician. Ma'am, I'll reframe this first one.
In determining their roles and responsibilities as a clinician.
Okay. Ma'am, my second intermediate outcome would be develop a professional identity and boost their confidence in handling patients. And also the last one is sufficient time for the understanding and treating complex cases in second and third year.
Patient in treating patients.
Okay.
So this will help also for them to concentrate on their project work, no?
Yes, ma'am. That's what I mentioned. Understand.
So add it.
Okay.
Next. Have you got ethical committee permission?
Yes, ma'am. Ma'am, our ethical committee is somewhat different than the rest of the institutions. Here, the involvement of other the service representative would be there. So it is done, ma'am.
So up to now, can you show me a questionnaire, what you have created?
Yes, ma'am. I'll share it with you.
Is the questionnaire already available?
Yes, ma'am. It is already been distributed to the first the questionnaire been prepared, ma'am. I discussed with you as well.
Have you taken permission from the author who created it, or you have created it yourself and validated?
Ma'am, I have created myself, ma'am. I have distributed to my guides, including you, ma'am. And I have discussed with the other faculty members who are the part of the teaching institute. So they have given suggestions.
Okay, fine.
And
send me the questionnaire again. I remember you had sent. You please
yes,
send it to
ma'am.
me on WhatsApp.
I've also got some the responses there. I'm able to upload it here. I've got the responses, ma'am. These responses are fixed. I'm making the analysis of those responses or required. These are all the pilot kind of a responses.
So what is your population?
Ma'am, I have taken the Delhi sub area as well as Pune, ma'am. The postgraduates, the faculty, administrative staff, and the people who have completed and working as a clinician at in various armed forces
Okay,
establishments.
fine.
So they makes up almost close to 100. So I have got around 30 responses, a mix of faculty, administrators, clinicians, and students. Few are having queries; they're coming back to me. Ma'am. So based on that, simultaneously Google Form is giving me the graphs of their responses. I'm accumulating all those things. So
Okay,
which is helpful.
okay, fine. Siddharth, continue. Gaurang, will you be Gaurang, nahi. Rohit, will you be presenting?
Madam, am I audible?
Yeah.
Madam, I have just made a note of like what progress I have done in my regarding my topic, madam. Like first thing was the criteria for selecting the students. Like from a batch of students, like I couldn't include all the students.
I can't hear you.
Ma'am, from the entire batch, I couldn't include all the students for this preclinical module. So we made up a few criterias like how to select the students. So what we did is we included only the fast learners in this particular project, madam. So that once the internals were over, third internals were over, then we did that based on their attendance, number of patients treated in clinical postings, and their internal assessment marks. We selected the students. Then we made a question MCQ based what do you call it, test, madam, comprising of 100 marks based on the syllabus for basic implantology, which is being prescribed by the DCA. Once that was done, madam, I have already
given it for undergraduate.
Yeah, madam, undergraduate only.
Yeah.
Then, madam, once that was over, I did it. I have given them a demo on this styrofoam jaw sets, how to do the placements of implant. Only the impression technique and prosthetic part is pending because they have internals due for them. Madam, I'm having a problem in fabricating the questionnaire for the feedback-based evaluation. I'm planning to take a 360-degree feedback. There, as of now, I have got ethical clearance. But the questions, whatever I have seen from the earlier questionnaires, it is like depending on the facility of the university and the college. So the principal of the college asked me to make the questionnaire limited to 5 questions, and it has to be fabricated in a such a way that I am not going to show the shortcomings of the college, like why we are not teaching them implantology or that. So that's a tricky part wherein I'm lacking to frame my own questions, man.
You cannot have only 5 questions, and you are not going to any which way show the lacuna of the college, because entire India, they don't have a proper preclinical module for implantology for BDS.
Because I told them that, sir, this is what
So
I'm
who
going
is your principal?
Madam, he's an endodontist, Masalkar sir.
No, I don't know the name.
So,
You use your skills to make him understand that it
madam,
is.
minimal, how many questions I can put?
So are you doing need assessment or are you doing implementation?
Implementation, madam.
Then there is no shortcoming. No. If you have a ready module.
Yeah, madam.
From where?
Madam, I have designed this module. There was no earlier modules, madam.
But who vetted it? Siddharth, there is a lot of questions. First and foremost, if the students, teachers, principal, or all stakeholders, is there a need to make this module of
madam. Yeah, madam, because it is prescribed by the dental council.
Dental council will say 100 things, man. We don't do everything.
That 30 hours is not being implemented, madam. So we integrated this module involving Department of Oral Surgery.
So don't ask question whether your college is using it or not. Then the principal will allow you to ask all questions.
Okay, madam.
See, you are doing need assessment, he's take objection. But if you are you're confused, man. You created a module. Did your staff members see it?
Yeah, madam. Oral surgery, prosto
no,
and
prosto kitna staff member dekha? Kitna meeting liya focus group ka?
Madam, team staff here, madam. One meeting we had before ethical.
No. You must have at least 3 or 4 prosthodontists or entire department of prosthodontics. You
Okay,
must
madam.
have oral surgeon, periodontist, and a radiologist, and also many a times we have a physiologist
Okay.
because of bone, etc. We have got lab technician. Inka ek focus group laga. Think about it and call me also. I'll attend it online.
Okay, madam. Okay, madam.
See, Siddharth, if I do something and try to impose it on you,
Yeah, madam.
it will become like a dictatorship. But
Yeah,
if
ma'am.
I ask you, see, what all the things should be implemented and how should, principal ko to pahila le.
Yeah, madam.
You think about it and you call me. Okay?
Yeah, madam. Yeah, madam.
Okay,
Thank you.
Rohit, are you presenting?
Yes, ma'am. I saw the progress, ma'am. सिद्धार्थ सर क्लोज करिए.
Okay, okay, one second. अभी ठीक है? Or
नहीं
still
सर.
it is-
हाँ.
एक सेकंड. देख हुआ?
Yes, sir.
It's done. Oh.
Got it. Ma'am, my screen is visible.
Siddharth, can you present your module to us on Tuesday and get an opinion with all of us?
Yeah, madam.
Okay. 5:30.
Yeah, madam.
Ma'am, shall I start?
Yes.
Ma'am, my study I presented in front of ethical committee last month and I got approval also. Now I'm going to present what I did till now. So my study is evaluating the effectiveness of early clinical exposure and clinic knowledge and prosthodontic skill question among second year dental student. So
Don't add the word randomized. Are you randomizing? What table have you used for randomizing?
actually, ma'am, that ethical people suggested me to use that word. I thought I had to take permission, so I put it that.
So what is the population?
50, ma'am.
So are you
In
going
that-
to put randomization table? Such mein?
Yes, ma'am, but not randomization. I'm going to divide into 2 groups.
Hey, that is not random. Your article
Yeah.
will never get published. See, remember, randomization is not even an odd number.
Okay.
Randomization table is given 1, 3, 5, 7. That is also not allowed. So there are randomization tables available because it should be blinded.
Okay.
Are you going to make it non-blinded?
No, ma'am.
First of all, read about randomization, how to randomize, what is randomized control trial.
Okay,
अरे ऐसा बड़ा words करने से ना, you get into trouble. I tell
Actually,
people, don't put the study design. You are not sure.
Yeah, ma'am. Actually, here what the ethical committee we are having, there are 4 staff from different colleges. So first
So
of
ask
yeah,
them, no, what is randomization table? उसको बोल randomize करके दे मुझे. If I
Okay.
make half the class, it will be biased study. If I take odd and
Yeah,
even
correct.
number, I know about it. That's not blinded. So generally, it is done like saying it is done 1, and suddenly you will go to jump and go to the 4th number. Then you may go to a number which is even, odd. So this table is already available. You can use any table. They are all very easily available on the net.
Computer generated randomized table, ma'am.
और ये randomized control trial क्यों यार? Because the randomized control trial है ही नहीं. और ये तेरा motive भी नहीं है. तेरा motive क्या है?
Yes, ma'am. Actually, the problem was there earlier. My HOD was
You should have.
HOD was not allowing only. Finally, after discussing with all the staff, they told to modify a little bit. I thought I have to do that.
Are
So
you
I
going to add
listened.
anybody's name in the study?
No, ma'am. I'm not adding.
Okay, now
But I'm
for
taking
now-
their help and permission because
No, see, listen. Now, for now, you accept it, you make a
Yes.
proper argument and don't present an argument. But you tell
Yes,
them,
correct.
Sir, you see, your randomization is like this. Now you only suggest what to do.
Yes, ma'am.
Last time one person was not allowing the person to carry out the study. Then I told him how to talk. Now you need to talk. Talking and making the person see your point, respecting his point is the skill, negotiation skill, what we all need to learn.
Yes,
Just
ma'am.
because he said you added, I will reject it. Because it is not a randomized control trial that is important here. It is your early clinical exposure, whether the students, why would you make a randomization here? Because you are individually seeing every student, whether it has made an effect, and we are, actually your topic should not have been on effectiveness. Who are you to make the effectiveness, man? It's a proved fact. And effectiveness on what? On the amount of knowledge they got, or on their attitude that they want to know more? What is it? Rohit, please understand this whole thing. You make a thorough thing and you present it not like this to me next time, but
Okay, ma'am.
at the individual slide. Before that, you and Siddharth are free to call me in the afternoon. I will, if I don't take the phone, I'll call you after some time. Listen to me. These are all serious matter. You can never ever publish such study. Okay? If you
Okay.
use a biased title, also you cannot publish. I will be the first one to take objection when you are presenting. See, this is all a learning curve for all of us. Your motive is good, that you want to know about early clinical exposure. So you could have just made it a small topic of attitude of the students. You please go through it. And now I cannot even make you change much because they will eat you up. Abhi, now your way is Rohit and you, Siddharth, that how you negotiate. You only
Okay,
tell
madam.
us how to do it. And you first of all read what is randomized control trial.
Okay, ma'am.
Chalo, okay. See you for the day.
Yeah.
Okay.
All of you close and let me see all of you. Okay. So see, our journey as a teacher is ever learning and being open. We don't want to ever criticize anybody. See, the people who told them the changes told from their point of view. They're justified for that. But I, as a researcher, will not argue, but negotiate. And my principle is important for my job also. So tell, sir, this is what I have found, sir. Now, can you guide me on this? They give them what they want. And this is not a cheap Muscovy. This is negotiate. Okay? This is negotiating. Acha, what all the leadership sessions I have taken for you? We have taken, I think, MBTI. We have taken working in teams. What else? So one session next time, I will not take the assessment, but I want you to go through the sessions and all of you to tell me what you have taken. Please recall and let's have sort of a test for all of you. Because I feel that either you're doing too many things at the same time, so you don't remember. That's the problem actually. Because somebody's doing PhD also, somebody's. If you're not able to have the whole plate, you're wasting the food. Somebody else would have eaten the food. So please see that what you are doing, if you're not able to apply at least 50% of what you learn here, my efforts have been useless. Even if you do that, Anand I was so happy he wrote, I am ready to present and all, and now he's disappeared. Anyway, it's okay. People have their own issues and I don't want to say anything. I want to close for the day. If anybody wants to say something, project has to be again and again presented so that your mind becomes, when I tell my issue to you, automatically some ideas come. in everyday life also. Three things as a teacher, as a researcher, and as a faculty we should know is that first thing, be strong within yourself, with your own self, that you're confident and you know your job. Knowing job is not 100%. Knowing job is trying to do the 100%. But you can never reach 100%. One. Secondly, the person in front of you, all are intelligent and all want to achieve and go somewhere. Be a team member. Appreciate them. They will also appreciate you. And if they don't appreciate you, you pat on your back and appreciate yourself. So always be happy. Know your job, be happy, and be curious to learn. Be aware of the environment. If you know everything and socially you cannot get along, it's a waste. Today, what interviews these children appear for the jobs abroad is just not only the subject knowledge. How much you can do problem solving for AI or machine learning. No, it's also how you can work in teams. That's why there are 3 or 4 series of interviews before they get the job. As a faculty, different people are there. See, we are all human beings and we are always our ego को थोड़ा अपन लाड करते रहते. अच्छा, हिंदी में नहीं बोलती हूँ. We're always feeding our ego. It's okay. Because our culture and our society, and as we are born, human being, ego is a part of us. But then remember, everybody else also has ego. Sometimes my ego will be higher, sometimes yours. So can we give a sort of a balance? I allow you. Before I say something, you also say, I already did that. I have already done something. And I say to you, no, that's not correct. I have done that. So it's I game has to go. Have you seen faculty members being lonely because of their disconnect with the other faculty? Everybody is not right. And every time, if you're going to pamper the ego of others to get a promotion or to be in the job, then also you will not be satisfied. You decide how you want to be satisfied. So I want to know and put in the group what is the leadership topics we have taken. Then I will be taking one more topic for you. Have I taken managerial leadership versus sustainable leadership and all? Okay, I'll try to do that. तुम पहला याद करके आओ क्या क्या टॉपिक्स हुआ है and little bit of recollection. Otherwise, you take the sessions are over because we have completed almost everything and you present your project. I will say, okay. And you get your certificate and you try to publish. People will take objection even on the topic what you are presenting. Okay? So have a good dinner. See you.
Okay. Good night. Good night.
Good night, ma'am. Good night, everybody.
Good night.
Thank you, ma'am. Good night, all.
Yeah, good night.